Okay, hi everyone. It's a little after 2 o'clock, so we'll go ahead and get started. Welcome to Medicaid Administrative Claiming. This is a time study training for ADRC staff and supervisors. My name is Jeanette Fong. I'm part of the Aging and Disability Resource Connection, or ADRC team here at the Department of Aging. So most of you are likely here today because you are an ADRC staff, either from a AAA or an ILC, and you were asked by your manager or supervisor to attend because you'll be participating in a time study next month. So this training is really geared for you so that you'll know exactly what to do when the time study begins. This training is also being recorded. So the slides and recording will be available for anyone who misses it and wishes to participate in the time study in the future. You may also be here because you just want to learn more about Medicaid administrative claiming. If so, that's okay too. Whatever the reason, everyone is welcome. So just some logistics before we get started. I will be going through the training material this afternoon. I believe everyone is muted now, but you will have the opportunity to unmute later and ask questions. In the meantime, please feel free to use the chat if anything pops in your head. And there's also closed captioning available if you would like. You can activate that by clicking on the live transcript button on the bottom of the screen. Okay, so moving on to the next slide, let's take a look at what we're going to cover for today. So our training today is really broken up into 3 simple parts. First, we want to cover some MAC basics so that you minimally have at least a basic understanding of what Medicaid administrative claiming even is. Once you understand that, you'll clearly be able to see why you've been asked to participate in this time study. And then for the next 2 items, we'll walk you through the actual tools that you'll be using. So we'll want to orient you to the actual ADRC activity codes that you'll be using to code your time. And then we'll also walk through the time study template and instructions together so that you'll know how to fill that out. So pretty straightforward. Okay, so what exactly is MAC? So obviously, no, we're not talking about Big Macs. We're not talking about the MAC Cosmetics line. And we're not talking about Mac computers or notebooks. So let's take a step back first and start with Medi-Cal. So remember, in California, our Medicaid program is actually called Medi-Cal. Medi-Cal provides free or low-cost health coverage for people with limited income and resources. And it's a joint program paid for by both the feds and the state. Medi-Cal also serves a whopping 1/3 of our state's total population. Now, how does Medi-Cal relate to MAC? Well, Medicaid Administrative Claiming, or MAC, is actually a way that states can get federal reimbursement for administrative activities that support the Medicaid program. So in California, we as a state can actually get money back from the feds by doing administrative activities that support our Medi-Cal program. The feds will actually reimburse us up to 50% of what we spend using our own state or local dollars to pay for these activities. So what do we mean by administrative activities, though? When we talk about administrative activities, we're not talking about actual Medi-Cal services or benefits that are covered by Medi-Cal. Those services are already partially paid for by the feds. What we're talking about here is getting reimbursement for administrative activities only. So those activities must help to either, 1, identify and enroll people into the Medi-Cal program, or 2, support the provision of Medi-Cal services. So a lot of things can fall under that broad second category. What does it mean to support the provision of Medi-Cal services? Well, it can mean you're helping people to access Medi-Cal services. Maybe you're providing information on Medi-Cal programs. Maybe you're providing actual referrals to Medi-Cal services. Or it can even mean you're participating in training to learn more about Medi-Cal programs and services. So all of those types of administrative activities are actually really important and necessary in order for the Medi-Cal program to run more efficiently and smoothly. So the big takeaway here is that to the extent that you all are performing even just some of these administrative activities, whether it's a lot or even just a little, there's the potential for your ADRC to get partially reimbursed back for the cost of those services. Okay, so we know we can get some money back, but exactly how do time studies come into play? So the way that the cost of administrative activities has historically always been calculated is through the use of time studies. And having staff document what they are doing at a given point in time. Now, this is completely different from the way you would go about getting reimbursed for actual Medi-Cal services. With services, there's typically a set fee or a rate of reimbursement, right? But with administrative activities, time studies are used to calculate the percentage of time staff spend performing those administrative activities. And then on the back end, we look at the total cost of those staff positions to figure out what the associated cost would be for just those administrative activities. Just so you know, there's a little bit of finagling going on behind the scenes as far as calculating that reimbursement. You also have to look at how each position is funded and how much of the position is funded by state or local dollars. But it's nothing I want you all to worry about right now. Your management and fiscal team will handle that on the back end. So our primary focus for the time study is really to just extract out how much time you spend performing administrative activities that support the Medi-Cal program. So yes, time studies, unfortunately, are unavoidable and will result in additional work for staff. We all know that nobody particularly enjoys recording what they're doing every minute or every hour of the day. That being said, we're going to do everything that we can to try and make this process as easy and painless as possible for you. But it's really important that we do invest the extra effort to participate in these time studies, because that financial payoff benefits not only your organization, but also helps to sustain the entire No Wrong Door system and all of the work that you do in helping people access needed services. MAC is also an ongoing source of funding for the ADRC. There is no cap on reimbursement. So as long as staff keep doing the work and can document how much time is being spent on administrative activities, and we can figure out that associated cost, we can keep getting that reimbursement. So why not get reimbursed if you all are already doing the work? Just so you know, MAC for ADRCs is really nothing new. Although this will be new for California, many other states have actually already implemented MAC. This map is a little bit outdated, and it shows Iowa is still pending federal approval for its MAC program. But Iowa was actually the most recent state to be approved by the feds just about 9 months ago. So all of those 16 blue states that you see, plus Iowa, are currently getting federal reimbursement and have ADRC staff participating in time studies for MAC. And then there are 11 states in yellow, including California, that are in the planning stages, just like us. So between the blue and yellow states, that's about half the nation. And as you can see on the bottom right-hand corner, the average claiming amount for most states ranges between 500,000 to 2 million per year. But it does vary considerably depending on a number of factors, including the size of the state and the number of ADRCs participating. In California, we are a very big state, and with our AAAs and ILCs as core partners, there is a lot of potential for reimbursement. So we want to make sure we're all taking full advantage of that and have as many ADRCs participating as possible. Okay, so that was the MAC overview portion. Let's get into the fun stuff now and look at the actual activity codes that you'll be using to code your time. So floating above this bowl of alphabet soup are 15 activity codes. These 15 codes represent all of the codes that you will potentially need to use to code your activities throughout the workday. You won't need to memorize them, but I think once you understand the basic structure of the codes, which we'll walk through together, they'll make a lot more sense to you. And I actually think you'll become quickly familiar with ones that you'll routinely use. But like anything, it'll just take a little practice. Okay, so with MAC, the codes need to represent all of the activities that you potentially perform, regardless of whether the tasks are Medi-Cal related and eligible for reimbursement. For time studies, the feds want us recording everything that we do. And then from that, we determine how much of those activities are Medi-Cal related. So even though there are 15 codes total, only 5 of those codes are Medi-Cal related and qualify as administrative activities that either help enroll people into the Medi-Cal program or support the provision of Medi-Cal services. So only 5 codes are reimbursable through MAC. And then the remaining 10 codes are not Medi-Cal related at all, and therefore not reimbursable through MAC. Okay, so let's look at our 5 reimbursable codes first. If you'll notice, all of these codes have one thing in common. They all end in the letter A, right? So all of these A codes are our Medi-Cal related codes. So let's start with 1A. At the heart of ADRC is helping people navigate through that confusing maze of long-term services and supports, right? So code 1A is all about providing that streamlined access to services. But in this case, we're talking about connecting people to Medi-Cal services in particular. So whether you're providing someone with information on a Medi-Cal program or service, providing a referral to a Medi-Cal program or service, following up with someone to make sure they got the Medi-Cal service you referred them to, or even helping someone to identify goals or develop a care plan that involves Medi-Cal programs or services. All of those one-on-one activities where you're helping connect a client to Medi-Cal services, whether directly through a warm handoff or even indirectly through providing information, would fall under code 1A. Now, code 2A. Code 2A is specific to applications and eligibility assistance. So you want to use this code when you're providing application assistance to help someone determine eligibility for Medi-Cal programs or services. Maybe you're helping someone who is not on Medi-Cal apply for Medi-Cal. Maybe you're helping someone who is already Medi-Cal eligible apply for Medi-Cal programs or services. This can even mean you're gathering information to help someone fill out an application, or even following up with a local office to check on the status of an application. all of those application-related tasks would fall under code 2A. Now, the next three codes are a little different because unlike 1A and 2A, those codes do not have to do with one-on-one interactions with clients. So code 3A has to do with providing general marketing or outreach to the public to promote awareness of Medi-Cal programs and services. So maybe you're at a community event or a health fair and you're providing information on Medi-Cal programs or services. Or maybe you're developing or handing out flyers that provide information on Medi-Cal programs or services. Code 4A is staff training. This one is pretty straightforward. It has to do with participating in any type of training that has to do with Medi-Cal programs or services. By becoming better informed about Medi-Cal programs, you can better assist individuals with accessing those services, right? So it makes sense that training would be included as an administrative activity that supports the Medi-Cal program. CalAIM, for example, is a big hot topic nowadays. So any trainings or webinars on CalAIM would fall under this code. Same thing with any trainings on any of the Medi-Cal waiver programs, MSSP, assisted living waiver, even CCT. And then finally, code 5A is quality improvement. For this one, a lot of activities can potentially fall under here, actually. Here we're talking about performing activities that improve the coordination or delivery of Medi-Cal services specifically. So it can mean a lot of things, including gathering and analyzing Medi-Cal data, tracking and trending Medi-Cal utilization, identifying gaps in care for Medi-Cal beneficiaries, participating in ADRC advisory meetings and work groups where Medi-Cal programs are being discussed. Okay, so that is a high-level overview of our 5 Medi-Cal related codes. So if your role at the AAA or ILC is primarily to work one-on-one with a lot of Medi-Cal eligible or potentially Medi-Cal eligible clients, I have a feeling you will quickly become familiar with codes 1A and 2A. Depending on your job description, you may or may not use the other codes as frequently, but it all kind of just depends on your job duties. Okay, so let's talk about activities now that are not reimbursable through MAC. Remember, there are 10 of them, but let's look at just these 5 for now. So if you'll notice again, these codes also have something in common. These codes all end in the letter B. We call these our parallel codes because you'll notice that the code numbers and category descriptions are actually exactly the same. The only difference is the letter. So these B codes are not reimbursable through MAC because they are non-Medi-Cal related. So with code 1B, we're still providing streamlined access to services, but this time we're talking about connecting people to non-Medi-Cal services. There are a lot of services out there that are not Medi-Cal services, right? So when deciding whether to use code 1A or 1B, you want to focus on the type of service you are connecting someone to. If you're connecting someone to a Medi-Cal service, use code 1A. But if you're connecting someone to a non-Medi-Cal service, use code 1B. Now, what's a little tricky here is that you may actually be using 1B when working with both Medi-Cal eligible and non-Medi-Cal eligible clients. Medi-Cal doesn't cover everything, so sometimes Medi-Cal eligibles too can be referred to non-Medi-Cal services. So just because someone is Medi-Cal eligible, don't just default to code 1A. You want to focus on the type of service you are connecting someone to and not necessarily their Medi-Cal status. So code 2B. This time you're providing application assistance to help someone determine eligibility for non-Medi-Cal programs or services. Again, those applications can be for people who are both Medi-Cal eligible and non-Medi-Cal eligible. So concentrate on the type of application or program you are helping them to apply for. If it's an application for a Medi-Cal program or service, use code 2A. But if it's an application for a non-Medi-Cal program or service, use code 2B. Code 3B would be used for any type of marketing or outreach to the general public to promote awareness of non-Medi-Cal programs and services. Code 4B is for staff training. This time you're participating in any type of training that has to do with learning about non-Medi-Cal programs or services, any training on Medicare, assistive technology, food programs, housing, so long as it is a non-Medi-Cal service. And then finally, code 5B, quality improvement. So any type of quality improvement activities that help to improve the coordination or delivery of non-Medi-Cal services. So between our A and B codes, we've actually covered 10 of our 15 codes already. So let's look at our remaining 5. So our remaining 5 codes are also non-reimbursable activities. So remember, we have our A codes that are Medi-Cal related, and we also have our B codes that are non-Medi-Cal related. Well, we actually have some C codes too, but our C codes are neither Medi-Cal nor non-Medi-Cal related. They're actually not related to services at all, but they're related to the ADRC program in general. So remember, with categories 1 and 2, you're working one-on-one with clients to help them access a particular program or service or complete an application to determine eligibility for a program or service. There are no C codes for categories 1 and 2 because we're not talking about one-on-one interactions. With the C codes, we're talking about general ADRC activities. So we actually only have 3C, 4C, and 5C. So for 3C, marketing and outreach, we're promoting awareness of the ADRC program in general, or maybe even awareness of your AAA or your ILC. So we're not trying to promote any specific service in particular. For that, you would use codes 3A or 3B, depending if it was a Medi-Cal or non-Medi-Cal service. But for code C, maybe you're handing out ADRC flyers at a community event or a health fair. Or maybe you're working on marketing and materials for your AAA or ILC. Those are both examples of general ADRC marketing activities. 4C is staff training. Here we're talking about general ADRC training. So the training, again, is not specific to a particular service. Again, you would use codes 4A or 4B for that. For codes 4C, maybe you're listening to a webinar on person-centered practices, or maybe you're taking training on options counseling. Maybe your AAA or ILC is training you on referral protocols between other ADRC extended partners. So again, the training is general ADRC training, but not specific to a particular service. And then finally, code 5A, quality improvement. I'm sorry, 5C, any quality improvement activities for the ADRC program in general would qualify under here. So those are our 3 C codes. Now, aside from our A, B, and C codes, we do just have 2 more miscellaneous codes that you might use, and those are codes 6 and 7. There are no letters for those. So code 6 is for general administration. Basically, use this code when you are doing anything that is not ADRC related whatsoever. So doing your timesheet, organizing your desk, maybe taking general online trainings like ethics or harassment, going to your weekly staff meetings, taking a paid break, or taking paid time off for an appointment. Code 6 is really your catch-all category for anything non-ADRC related. And then finally, there's code 7. Code 7 is a little bit tricky. And for this one, you may need to have your supervisor help you out with this one. Basically, code 7 is used for activities that are already reimbursed for on a fee-for-service basis by another funding source directly. So code 7 is really used to make sure we aren't double dipping and trying to get reimbursement for activities that we've already gotten paid for direct. So say, for example, your AAA or ILC is a provider of Cal-AIM. Although you may be working directly with a Medi-Cal eligible client to help them access a community support like housing, your organization is already getting paid for that direct by the health plan through Medi-Cal. So in that case, we wouldn't code that activity under code 1A, we would use code 7 instead. Another example is if, say, you are a provider of CCT, which is the California Community Transitions Program, and say you spend a certain number of hours developing a transition plan for a client. Well, your AAA or ILC may already be getting reimbursed for those hours direct by DHCS. If so, that would be another one where you would code that activity under code 7 and not 1A. So again, this one can be tricky, so do consult with your supervisor before using this code. But in general, for the most part, you're going to code the activity for what it is under the other codes. Okay, so that was a really quick overview of the coding structure. Again, there is no need to memorize them. We've actually created quite a few reference tools, or rather cheat sheets for you to help you out. So there are 4 of them, and they can all be found on the ADRC webpage. So let me show you how to get to them. So you'll want to go to our main ADRC webpage. There's a Medicaid Administrative Claiming tab you want to make sure you're clicked on. And if you scroll all the way down, there's a drop down for general resources. So that's where you can easily find the 4 tools that we've created to help you out with the codes. So again, there are 4 of them. 3 of them are actually really good quick reference cheat sheets for you. So we have a code table, we have a code diagram, and we have a code decision tree. Those are all just 1-pager quick reference tools to help you out. And then there's also a more comprehensive code guidance manual. So the code guidance manual will actually give you definitions for each of those code categories. It'll provide definitions for each code, and all of those examples I quickly went over verbally, they'll give you those examples as well in the document. So that's a good one you want to keep as a reference tool. So I think the easiest thing to do is maybe to just walk you through each of these documents together. So it'll save you the time later on. So let's start with the code table. Okay, so here is a very simple table of all of our codes. Going across, we have the code categories we went over. So streamlined access to services, application and eligibility assistance, marketing and outreach, staff training, quality improvement, general administration, and other funding sources. And then there's a column in the middle with our 5 reimbursable codes, our A codes. And then there's also a column on the far right of our 10 non-reimbursable codes. So our B and C codes, and then also those miscellaneous other 2 codes. So if you start with category 1, it's really simple to follow. You can use code 1A if you're providing streamlined access to Medi-Cal programs or services, or code 1B if you're providing streamlined access to non-Medi-Cal programs or services. For the second category, application and eligibility assistance, code 2A if you're providing application assistance to help people apply for Medi-Cal programs or services, or 2B if you're providing application assistance for non-Medi-Cal programs or services. 3A is for marketing and outreach for Medi-Cal programs or services. Code 3B is for marketing or outreach for non-Medi-Cal programs or services. And then remember, we also have that 3C code for just general ADRC marketing and outreach. Staff training, 4A for Medi-Cal training, 4B for non-Medi-Cal training, or 4C for just general ADRC training. We have 5 for quality improvement, 5A if you're doing quality improvement activities that relate to Medi-Cal programs or services, 5B for quality improvement activities that relate to non-Medi-Cal programs or services, or 5C for general ADRC quality improvement activities. And then we have our general codes 6 for anything that is non-ADRC related, and 7 for other funding sources. So just a really quick table that could be a resource for you. We also have a really neat code diagram. If you're not a fan of the table, this diagram is kind of a neat way to kind of figure out what you're doing and then find the right code for it. So again, we have our categories. On top, we have 1, streamlined access to services, application and eligibility assistance. Those 2 categories have to do with all of those one-on-one interactions you do with clients. And then we also have our other activities that don't so much have to do with one-on-one interactions, but they're activities you may do nonetheless. So this one's a really good visual diagram to kind of help you figure out what you're doing. So starting with streamlined access to services, a lot of times people come to the ADRC, the AAA or ILC, either by phone, your info line, or in person. Sometimes maybe you do an initial intake or an assessment. Sometimes that call or visit goes a variety of different ways based on the needs of the client. So maybe you are providing a simple information and referral if they know exactly what they need and want. Other times, maybe you're helping them weigh out their options. So you're doing options counseling. Maybe they are facing a crisis and you are helping them coordinate services on a short-term basis. Or maybe they need transition or diversion services. So any of those one-on-one interactions where you work with clients to help them broadly providing streamlined access to services, those would fall under code 1. Either A, if you're helping them access a Medi-Cal service, or B, if you're helping them access a non-Medi-Cal service. So all of the ADRC service functions fall under this big, broad category. Any referrals you're making, intake, interviews, assessments, goal planning, following up or monitoring services, offering support. These are just examples of activities that can fall under here. Application and eligibility assistance. Again, you see the A if you're providing application and eligibility assistance for a Medi-Cal program, or B if it's a non-Medi-Cal program. And then for these codes, these other categories, marketing and outreach, training, you can see where there's a respective A, B, or C code here. So this is another good just visual diagram for you if you're having difficulty deciding on which code to use. And if you're not a fan of the table or maybe this diagram, we also have, as a last resort, a decision tree to kind of help you out. This decision tree is more of like a process of elimination, and it will walk you through a series of questions to get to the right code or the appropriate code if you need that extra guidance. So all of these apples in the tree represent codes. All of our 5 reimbursable codes are the green apples, so our A codes. And all of our 10 non-reimbursable codes are the red apples. So to use this, you really want to start on the bottom left-hand corner, and you're going to ask yourself, is the service I'm providing funded directly on a fee-for-service basis by another funding source? If the answer is yes, you're probably going to code it code 7. If the answer is no, you're going to move on to the next question. Am I providing application and eligibility assistance to someone? If the answer is yes, is that assistance to a Medi-Cal related program? Use 2A. If it's not, 2B. If you're not providing application and eligibility assistance, are you providing streamlined access to services? Are you helping to connect someone to a service? Whether it's information, a referral, counseling, monitoring, follow-up. If the answer is yes, is it to a Medi-Cal related service? Yes, 1A. If no, 1B. If you're not providing streamlined access to services, you move on to the next question. Are you providing marketing and outreach? Is your marketing and outreach general ADRC program outreach? If yes, that's where you use your 3C code. If no, is the outreach for a particular Medi-Cal related service? Yes, you use 3A, no, 3B. So that's kind of to give you an idea of how the decision tree works. You don't have to use it, but again, it's just another tool out there available for you. And then we have the more comprehensive code guidance manual. It's not too long, it's about 11 pages. We won't go through this one, but you do have it for you as a resource. It's going to provide a concrete definition for each category, and then also for each subcode, a definition as well, and then a lot of examples. So these examples, just know they're not all inclusive. They're just examples to give you an idea of what could fall under that potential code. Okay, so let's get back to the slide deck. So hopefully that walkthrough helps to at least kind of reinforce those codes for you a little. Again, you don't need to memorize them, but the tools are available for you. Okay, so the last segment of this training covers the time study. So remember, with the time study, the whole purpose is to have you code your daily activities using those codes so that we can extract out how much time is actually being spent on those 5 Medi-Cal related codes that are eligible for reimbursement through MAC. So here's just an overview on the time study process. These time studies will be done on a quarterly basis. The good news is that you are not going to have to code your time for every single day of the quarter. The bad news is that you are going to have to code your time for 12 days of the quarter. We've determined that 12 days represents the smallest possible sample size, where if you are coding your time in 15-minute increments throughout the day, it gives us a good enough sample where we can say, okay, those 12 days are representative of how you spend your time for the entire quarter. So 12 days throughout a quarter, you'll be coding your time. And we've actually set it up to where it will always be 4 days per month. And those 4 days will always be in the same week. Okay. So let's walk through the actual time study template that you'll be completing so you know how to do that. Here's just a screenshot of the template. You see there are 15-minute increments here. You'll be asked to select an activity code and then really just provide a brief activity description. Okay, so what I'm sharing with you is an Excel spreadsheet. You will be getting an Excel spreadsheet to work with for your time study template. As you can see on the bottom, there are 16 tabs. 12 of those tabs actually represent the 12 days that you'll be filling out the time study template. So here's a blank one, for example. It's a pretty basic template. Again, you see the 15-minute increments down the far left-hand column. There's a column to choose an activity code and a column to put a brief activity description. And then there are a couple columns related to eligibility status, which we'll get into later. So all of these days look the same. You do also have 4 tabs that are more so resource tabs. So you don't necessarily need to do anything with these 4 tabs on the far left. The first tab is a summary tab. This really is a data roll-up tab. It really just compiles data from each of the 12 tabs to give us a percentage of how much time you are spending on each of those codes. So it has brief self-identifying information on top, just your name, your position, what ADRC you're from, whether you're from a AAA or an ILC. And then it also has the 15 codes here. So we have our 5 Medi-Cal related codes and our 10 non-Medi-Cal related codes. And what it does is it pulls data from each of these date tabs, and it gives us a count of the number of times each code was used. So this data Rollup tab really just kind of summarizes data by month. So you can look at each of the 3 months in the quarter, and then it also rolls up the data for the entire quarter. This is more for your supervisor and for CDA to look at more so than staff. You can definitely look at it if you're interested, but it does provide the breakdown of how much time you're spending on Medi-Cal codes versus non-Medi-Cal ones, both by month and then also by the quarter. So really the purpose of the time study is really for us to extract out this percentage here, the percentage of time that you are spending on those 5 Medi-Cal related codes for the entire quarter. And then on the back end, that's where we kind of figure out how your position's funded to figure out dollar-wise how much this equates to. But again, nothing you all need to worry about for the time study. We also have an instructions tab here. So this contains line-by-line instructions of how to fill out the template. It has the role of CDA staff as far as preparing the template for distribution. CDA will always predetermine which dates are surveyed for the quarter. We will populate these 12 tabs before sending it to your supervisor. It also has the role of your ADRC supervisor as far as distributing the template to staff. We want you as a supervisor to take a look at the dates ahead of time. If you have any staff that are participating in the time study and there is a known absence for the week, let us know so that on a case-by-case basis, we can arrange for other dates. And then this big section here is for ADRC staff, and it contains instructions on how to complete the template. So starting with the summary tab, it'll show you, you need to put your name, your title, the name of your ADRC. There's a drop down to select a AAA or ILC. And then it also tells you, you don't need to worry about anything else on that summary tab. We'll go through this a little bit together, the highlights. And then also, once the ADRC staff completes the template and finishes the 12 days, there is also guidelines for the ADRC supervisor to review the template and validate certain elements. So I think let's just start. We'll start from scratch so I can kind of walk you all through this template. Again, you'll see the 15-minute increments on the far left-hand side. It ranges from 7 o'clock to 6 p.m. If you don't start until 8 o'clock, that's fine. You just leave it blank. So for the activity code, this is where you'll see a drop down of the 15 codes right here. So you'll just select the code. And the description is there too. I'm doing all of the A codes, those Medi-Cal related ones for now, so that you can see it's auto going to populate it into a red row. So that's going to happen for all of the 5 Medi-Cal related codes, are A codes. And then you'll see if you use one of the B or C codes or those other codes that are non-reimbursable, it's going to turn them green. One thing about this, I know it's 15-minute increments and that seems like a lot. You do not have to do this throughout your day. If on a scratch piece of paper, or you all with your AAA or ILC use some other documentation system like another database, you can transfer data over to the spreadsheet later on. So it's not required you do this throughout the course of the entire day. You can do it at the end of the day. In the instructions, we ask that you at least do it within 48 hours though, okay? So it may be difficult to do it in little 15-minute increments. Sometimes you may work on tasks for longer than that. I will show you how to do that later. One more thing about the activity codes, you only want to select a code for paid time only. So that's really an important thing to remember. So say, for example, for lunch, I don't know about you all. For me, I'm not paid for lunch. With the state, we are paid for breaks, but not lunch. So I don't want to put a code for something that is unpaid. So I wouldn't put a code for lunch, but I could put an activity description. On the other hand, if say I take a break, 15-minute break at 11 o'clock, I would want to select a code for that one. So here's where I would use that general administration code. And the reasoning behind that is because on the side for each of these daily tasks, it's counting the number of occurrences for each code. And all of this data, again, gets rolled up into that summary tab. So when we come up with this percentage at the end and we're trying to figure out dollar value, how much this equates to, we do not want to be coding time for things that are not paid for. Okay, so keep that in mind. You can still use the activity description, but just don't put a code. Only use a code if it's for paid time. Another thing to remember, let's say you are at a outreach event or something like that, and you're providing general outreach on your Adrc or your AAA or your ILC. Say you're not going to be there just for 15 minutes. You're likely going to be there much longer, maybe the entire day. So you can say attended outreach event and handed out Adrc flyers or something like that. You don't have to type this over and over again. You can do, if you want, you can do same as above. You can also do those little quotation marks over and over again, depending on how long you did the activity, or if you're working with one client for an hour, you don't have to type it over again, but you do need to put that same code over and over again. So that's important too, because remember, each of these 15-minute increments are being weighted equally, and all of those need to be tallied and reflected in the little summary chart here, because this is the only way the data is going to get pulled into, again, the summary tab. Okay, so paid time only. And if you're doing the same thing over and over again, just keep using the same code, but you can do shortcuts on the description itself. Okay, another thing. So aside from the code column, the description column, pretty straightforward. It doesn't need to be super long. It could be a sentence shorter than that. You'll notice there are 2 eligibility columns as well. So going back to, actually, I did not share this tab with you yet. Another one of these resource tabs are the code cheat sheets. So we've actually pulled them into your template itself, so you don't have to keep those separately. So you'll have the code table for reference, the code diagram for reference, and if you want, the code decision tree for reference, all within the same document. The only thing that is not in here is your code reference manual. So you do want to keep that on the side if you do need to refer to it. But what I was going to say is, remember, for categories 1 and 2, those are the only categories where you're working one-on-one with clients, either helping them to access a service or helping them with an application. So for those one-on-one interactions on the spreadsheet, that's where we ask you to put the client's eligibility, Medi-Cal eligibility status. Okay, so you have 3 options here. They're either Medi-Cal eligible, meaning they've been determined by the county to qualify for Medi-Cal. They're potentially Medi-Cal eligible. Maybe they qualify. Maybe their application is still pending. Maybe you think they meet the criteria, but they haven't yet applied. That's potentially Medi-Cal eligible, and then not Medi-Cal eligible. They're not. So for those categories 1 and 2, that's where you'll be required to put in the eligibility status and eligibility notes. So for marketing, training, quality improvement, that's where you'll see these 2 columns automatically grayed out. You don't need to put the eligibility status for those, but you do for any of those 1 or 2 codes, whether they're A or B codes. One thing to remember, and it can be a little tricky with your A codes. So remember, you're providing streamlined access to Medi-Cal service, or you're helping someone fill out an application to determine eligibility for a Medi-Cal service. You're probably always going to choose Medi-Cal eligible or potentially Medi-Cal eligible, because you wouldn't really be referring someone to a Medi-Cal program or service if you didn't already know that they're Medi-Cal eligible. Potentially Medi-Cal eligible might be an option if, say, you're just providing information to somebody who might be interested in learning more about Medi-Cal programs. But for these A codes, you're probably not going to use this not Medi-Cal eligible. You may use it for the B codes. And then remember, again, you may also use Medi-Cal eligible for the B codes as well, because you may be referring Medi-Cal eligible folks to non-Medi-Cal programs. So do your best. We just ask you to do your best to choose one here. And then for the notes, do your best to document your rationale. I know the AAAs and ILCs, you all may do it a different way. Some of you may have a database you can check. Some of you may have a phone number you can call. Some of you may just be asking, maybe some clients have their identification card and you can jot down the number. Maybe they are enrolled in a Medi-Cal managed care plan and you can note that. Just do your best to document your rationale for selecting the status. If you're really having trouble, we do include a hyperlink here. It takes you to the DHCS webpage. It's just a general DHCS webpage that I think has the simple qualifications for if someone qualifies for Medi-Cal. So you can even kind of try to use this as guidance if you're having trouble. Maybe someone is already on SSI or qualifies for CalFresh, and that's the reason why you're using to justify their status, and that's fine. We just ask that you do your best. So that's, I think, a high-level overview on how to complete the template itself. I didn't go over this. This is another good resource tab. It's a sample. So basically, we made sure we at least have one example for each of those codes. We show you how to select the activity. These are just examples of activity descriptions, and then also the eligibility status. Actually, I did think of another thing I want to mention. For the red rows in particular, these are all reimbursable activities. When you do your activity description, you want to make sure it's very specific as far as documenting the type of connection to the Medi-Cal program. So for 1A, for example, remember 1A can involve providing information or transition services or options counseling. So you want to make sure in the activity description, you're very clear on what service you're providing. Was it just information? Was it a referral? Was it an application you were assisting with? And then also, what specific Medi-Cal program or service were you helping them access? Did you provide a referral to MSSP? Okay, so for all of these red ones, remember, these are the activities we're trying to get reimbursement for. So it's really important that the connection to the Medi-Cal program is clearly documented. And that's for audit purposes. If CDA goes and reviews this, or if CMS, the feds, goes and reviews this, they want to make sure if they're going to be reimbursing us, there's a clear documentation trail as far as the member's connection to the Medi-Cal program. For all of the red rows too, you will be asked to maintain documentation. Again, we're not asking you to duplicate work. If you already have case notes documented in your online database system, or if you have the application itself as evidence, or the agenda for a meeting that you attended, or the slide deck on a training you attended, just make sure you have that readily available in case somebody asks for documentation. So those are just for those red Medi-Cal reimbursable activities only. So that covers pretty much the staff's responsibilities as far as filling out this grid for each of those 12 days. The instructions also cover kind of a review process for the supervisor. And it's basically the same thing. After the end of the quarter, or kind of throughout, it's up to you how you want to do it. You're going to want to do a review of each spreadsheet for your staff. So again, just making sure that they're filling this out, if not on a daily basis, inputting it into the spreadsheet itself, they're at least transferring it within 48 hours. You also want to do a double check to make sure they're only putting codes for paid time only. You also want to validate for each one of the red rows that the activity code and activity description match and they make sense. For any of those 1A, 2A, you want to make sure the eligibility status is Medi-Cal eligible or potentially Medi-Cal eligible so that it makes sense. So we just want to pay extra attention again to the red rows. We do want you to do just a scan or spot check of the green ones just to make sure we're not miscategorizing any Medi-Cal related activities that we're miscoding under the non-reimbursable activities. And then we also want you to check for at least maybe one, I think in the instructions it says to check for one red row a month, the supporting documentation. So ask your staff to take a look at that. Supervisors, we also want you to kind of look at this, the daily sum up. If this number should be about 32 if they are working that full day. So there are 4 15-minute increments in an hour. So in an 8-hour day, there should be about 32 here. So you want to do a little bit of a checks and balances on here. You can kind of review this too to see if there are any noteworthy trends, making sure they're not overusing maybe that administrative code or the other funding source codes. If you see them using it a lot here, that's where you want to go back and check all of those to make sure they're being coded appropriately. So again, for each of those days, you can kind of do a little review of the summary. And then also on the summary tab, same thing, just looking for the prevalence of certain codes, looking for patterns where you think there may be errors, maybe not. And then just kind of based on that, assess if there are technical assistance needs, further training needs, things like that. The most important thing too for supervisors, I put a little note here. For each staff participating in the time study, this number here, the total number of occurrences for each code needs to be at least 325. If it's less than that, reach out to CDA as soon as possible. Remember, we talked about 12 days being that smallest sample size that we can whittle down. That has to do with 325. That equates to 325 15-minute increments. So if this number is any lower than that, that's where this sample is no longer statistically valid. So we're going to have to figure out how to bump up that number and have someone do an extra day or something like that. Okay, I know that was a lot. Let's see, let's go back to our slide deck. We are almost done, you guys. Okay, so next steps. As far as next steps goes, we are piloting this time study in the 3rd quarter of this calendar year. So July through September. Even though July is just around the corner, the first survey date won't be until the week of July 18th. So that still gives your supervisor time to decide on who they want to have participate in the time study. Next week, I will also be sending out an email to all of the ADRCs asking them to let me know which AAAs and or ILCs will be participating in the time study. That way I'll know who to send the blank time study templates to. And then once the quarter is over, we will work directly with the ADRCs to take a look at all of the data. We'll take a look at the percentage of time staff are spending on activities that are reimbursable through MAC and see if we can look at the funding for each of those positions to kind of calculate the potential for reimbursement. Now, this is just a pilot time study, so we are just going through the motions as if we are actually seeking reimbursement. Unfortunately, we can't do that quite yet. The feds still need to review and approve our entire MAC process before this can even be fully implemented and we can start getting reimbursed. So we're just testing this out for 1 quarter first to see how it goes and what the potential reimbursement will look like. Okay, so that is about it. If at any time, whether it's before the time study, during, throughout the course of the time study, if you have any questions at all, whether they are questions on codes and you're not sure which codes to use, or if it's on how to complete the time study template itself, do feel free to reach out to our general ADRC inbox. If it's MAC related, it'll find its way to me, or you can always email me direct at any time too. That goes for staff, supervisors, anyone who has any questions on MAC. We can always jump on a quick call, or I can walk you through any of the tools again, not a problem. So this is brand new, and we do anticipate there will be questions. Okay, so I think I'm gonna go ahead and unmute everybody, or give you the capability of unmuting yourself, and then we'll take a look at what questions we have in the chat, or if anybody has any questions.
I do have a question. This is Hayam from PSA 21. Could be very simple. Hi. So for ADRC call center, you mentioned about 15 minutes increment. What if, like, within that 15 minutes increment, you had both, you know, A and B? Then which one would you indicate?
I would indicate A, and then make sure in your activity description, you still clearly indicate minimally at least the Medi-Cal related service that was discussed.
Okay, got it.
Lee, I see your hand up.
Yeah, thank you. Lee from Marin County's One Door ADRC. I represent the AAA, and we also have Julia from ILC, who's our One Door administrator on the call. just want to say what a fantastic presentation, Jeanette. You were so clear in explaining all of this, at least in my perception. So thank you very much.
Thank you, Lee. Yeah, it's kind of a hard thing to wrap your brain around. And I want to say, though, we worked really hard with select AAAs and ILCs. We had work groups along the way, not only to develop the codes together, to make sure we had input from both the AAAs and the ILCs, and then also to develop this time study template that hopefully kind of works for everybody. So also just a big thank you to our work groups who have really helped out with this process.
Yeah, well, thank you to them. But again, you did a really great job of making it simple enough to be understood for those of us who haven't delved into it. So thank you.
I agree with Lee, and as a member of the work group, Jeanette, you took our ideas and made them very visually appealing. So you need to take credit for that. We're saying thank you.
Thank you. You're welcome. Megan.
Hi, everyone. This is Megan. I just want to be really clear about what's allowable to make sure that we're tracking the right things. I want to give an example and see if this is an allowable cost. Let's say that we're helping someone, a Medi-Cal recipient, to transition out of a nursing home, and we're spending some time setting up CalFresh or finding their local food pantries. So it's not necessarily a Medi-Cal related activity. It's related to another type of LTSS, but it's for a Medi-Cal recipient. Would that be allowable?
You would code it for the service that you're referring them to. So even though they're Medi-Cal eligible, if the service itself is for a non-Medi-Cal service, then you would use that 1B versus the 1A.
Okay, and then that would not be covered then.
Right. It's a little tricky, and a little bit tricky for me too, because the Medi-Cal services are under the Medi-Cal state plan. So I'm not exactly an expert in that. Some of you may or may not be even more expert. So sometimes even like IHSS, if it's Medi-Cal, then it would be 1A. But sometimes people qualify for eligibility for non-Medi-Cal programs because they're Medi-Cal eligible. So focus on the program and service itself. If it's a Medi-Cal program or service covered under the Medicaid state plan, you can do it under a reimbursable activity.
Can I give another example? Just want to be clear. Let's say that we have someone who uses IHSS and we're helping them to look for a caregiver so that they can utilize their IHSS. Would that be covered?
I'm not 100% certain. I don't know enough about IHSS. Is it a Medi-Cal? Is it a Medi-Cal?
Yes, and I'm thinking that this kind of claiming structure could really have a significant impact on our personal assistant services team, because they exclusively do IHSS work. That's really our main connection to Medi-Cal would be through IHSS, and this is what we anticipate using it for.
So if IHSS is covered under the state plan as a Medi-Cal service, then all of that work related to helping somebody navigate IHSS, find a caregiver, paperwork, transportation to a home visit, all of that would qualify then.
Perfect, thank you.
Carolyn?
Thank you. I just wanted to make sure, as an emerging ADRC, I'm with PSA 3 in NorCal, actually 2 and 3. I want to make sure that as an emerging, our hours are qualifying for this study as well, or do we have to be the designated status already?
Great question, Carolyn. So we would love it for both designated and emerging ADRCs to participate in this pilot time study. It's just a mock activity we're going through, so we're not actually claiming reimbursement quite yet. As far as our implementation timeline goes, it's still a little bit out. We don't anticipate implementing this until as early as July of 2024. So by that time, a lot of our emerging ADRCs will likely become designated by then. But when this does eventually get implemented, only designated ADRCs will be allowed to request reimbursement.
Got it. Got it. That's understandable. I just wanted to make sure because our intention was to position ourselves to at least be able to help in this study in the last quarter, but we know we won't be designated by that point.
Yeah, and we're really happy to have all of our emerging ADRCs participate. I think the more data we can get with this pilot time study, the better we'll be able to approximate our potential for reimbursement as a state. And
Perfect.
once we even do this pilot study, it's not to say that there won't be another one again. We do foresee doing this several more times up until the point of implementation even.
Thank you so much.
Okay, I didn't take a look at the chat. So again, feel free if you guys have any questions, feel free to ask away. Kelly, I see your question. Okay, it was already answered about the breaks. Well, you all are letting me off easy. They're just comments in the chat box.
I did kind of want to piggyback on, this is Wilson, piggyback on what Ha-Young mentioned earlier about, what makes it reimbursable, not reimbursable. So a strategic way to make it reimbursable is if the intention of the staff, if the original intention of the staff was to go out to do, let's just say, an outreach event, and you were just going to talk about, your AAA or your ILC as part of the outreach, make sure that staff member is trained about Medi-Cal related services, bring some brochures, information to talk with people about it. And when you are talking to people about your AAA or ILC, also talk about Medi-Cal services that they may be eligible for, and make, so that way that 15-minute increment plus more may be, in that case, reimbursable, rather than just talking about the AAA or ILC. So those are some just strategic and creative ways to make sure that we're outreaching about the Medi-Cal program and letting people know about the Medi-Cal services and get reimbursed for it.
I have a quick question. If, so say you are at one of those outreach events and you're there for 5 hours and you know that, 80% of the people that you talk with, you mention something related to Medi-Cal, can you count the whole thing as one, or do you have to do it literally by the 15-minute increment? So if you go, one of those 15 minutes without necessarily talking to a specific person, you have to block that out, or can you bunch it?
I would bunch it for that one. Yeah. So just make sure in the activity description you're clear. You can mention even the specific Medi-Cal programs you touch on throughout the day. And then, yeah.
And then same if it's like a staff training, but there is, adequate mention of Medi-Cal or ADRC. Do you think that's the same?
Yeah.
Okay.
So examples of like supporting documentation for that could be like the agenda or something like that. Even our ADRC advisory meetings, there's quite a bit discussion on Medi-Cal programs in those. So I would say even like the 3 hours we have for ADRC advisory meetings would count. Jaden?
Yes, thank you. This is Jaden from the Ventura County ADRC with ILRC. I just want to echo everyone. Thank you so much, Jeanette, for making this so plain and simple. It wasn't this way prior, so I'm thankful for that. And you might have answered my question already, but I was just wondering if, I know that the first one starts on, for example, July 18th. If we have staff that are scheduled to be out or happen to miss that day, will we just contact you, or how can we go about rescheduling that?
Okay, so it's 12 days, but really it actually has a built-in cushion. So it has like a 15% extra bump on. So I think within the 12 days, it's more like 10, a little bit more than 10 they need to be there for. So if it's just one day they're going to miss, they'll be fine. We'll still reach that threshold for that sample size that we need. So if it's just a day, I wouldn't worry about it. But if it's anything more than that, let me know, and then we can arrange for an alternate date for that person.
Thank you.
Yep. Thank you. Okay, we have about 15 more minutes. If anything else pops in your mind, feel free to stay on and ask it. Again, for next steps, the recording and slide deck will be posted to our website, and then I'll follow up with ADRCs next week to see who wants to participate in the time study. And then hopefully we get quite a few AAAs and ILCs that would like to participate.
Jeanette, would you like to say anything about the breadth of number of people? Are you looking for just people who are designated as ADRC funded? Is this a broader sweep? Is it more data the better? What's your perspective on that?
I think the more data, the better. So as many people as we can get. It's hard to know what the data will look like until we actually do it. So it'll be really interesting actually to see just the range that may come in and even the difference from AAAs and ILCs or across ADRCs. So happy to have anyone who is willing to participate. And if you have just a few staff or you have a lot of staff, it doesn't matter, whoever you'd like to participate. Ideally, it's anyone who does any of those ADRC activities on the diagram, that code diagram would be ideal. And then I know funding sources is kind of another topic we're going to tackle next. So while this time study is ongoing, I'm going to work with that same time study work group, and we're going to figure out how to break down that funding piece. Okay, well, you are welcome to stay on if you'd like, if you have further questions. But if not, I thank you again for coming, and thank you for listening and attending and for your participation.